Good afternoon, everybody. We, Sri Dharma Salmanjanatheshwara College of Ayurveda and Hospital Udupi, are conducting Charaka Sambhasha program in association with the Department of Ayush, Government of Karnataka, Vishwa Ayurveda Parishad Karnataka and Government Ayurvedic Research Center Mysuru from August 2021. Today is the 22nd edition of the same. Today we have with us Dr. Kiran Goud sir, the principal of Sri Kalabhairaveshwara Ayurveda Medical College and Research Center, Bengaluru. So before beginning the program, I would like to welcome the dignitaries. Dr. Mamta KV, the principal, SDM College of Ayurveda, Udupi, for the program. We welcome you, madam. I also welcome Dr. Ellen Shanai of Government Ayurvedic Research Center, Mysuru, Assistant Director. We welcome you, sir.
Thank you, Srikant.
I welcome today's guest speaker, Dr. Kiran M. Goud sir, the principal, Sri Kalabhairaveshwara Ayurveda Medical College and Research Center, Bengaluru. We welcome you, sir.
Namaste. Thank you, sir. Thank you, Srikant, sir.
I also welcome Dr. Nagarajas, the Medical Superintendent, SDM Ayurveda Hospital, Udupi. I welcome Dr. Niranjan Rao, Dean PG and PhD Studies, and I welcome all the audience. So, before beginning the program, we would like to begin the program with the invocation by Miss Pavana and Miss Sharada. Over to them.
शंभो गिरीश सुरपूजित कामवैरिं गौरीश शंकर महेश्वर विश्वहेतो शंभो गिरीश सुरपूजित कामवैरिं गौरीश शंकर महेश्वर विश्वहेतो धर्मस्थलेश सकलेशा दयापयोधे श्रीमञ्जुनाथ नितरा कुरु मङ्गलं मे धर्मस्थलेश सकलेशा दयापयोधे श्रीमञ्जुनाथ नितरा कुरु मङ्गलं मे कुरु मङ्गलं मे कुरु मङ्गलं मे.
Now I'd like to give a brief introduction of our guest speaker, Dr. Kiran M. Goud sir. Sir is presently the principal of Sri Kalabhairaveshwara Ayurveda Medical College and Research Center, Bengaluru. Sir has completed his BAMS from Government Ayurveda Medical College, Bellary. Has completed his post-graduation in Kaya Chikitsa, that is MD, from Government Ayurvedic Medical College, Mysuru. She is a proud Shishya of eminent Panchakarma therapist, late Dr. Ishwar Reddy sir of Bellary. He is the member in Ethics Committee, NIMHANS, CCRAS, and Sanskrit University. He has guided many PG and PhD scholars in the Department of Panchakarma. He has published more than 30 articles in national and international journals. He has delivered many lectures in various conferences and workshops. Sir is the editor in Ayush Rajiv Gandhi University Health Sciences Journal, and he has worked at SDM College of Ayurveda, Hassan, and Karnataka Ayurveda College. with this brief introduction, so I would like to hand over to the scholars for the Parayan of the 22nd chapter of Sutrasthana, that is Langana Brahmaniya Adhyaya. Over to the scholars for the Parayan.
नमामि धन्वन्तरिम् आदिदेवं सुरासुरैर्वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशम् दातारमीशं विविधौषधीनां धन्वन्तरीरमानाथम् सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जनाः सुखिनो भवन्तु सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः लङ्घनं ब्रह्मणं काले रूक्षणं स्नेहनं तथा स्वेदनं स्तम्भनं चैव जानीते यः स वै विशक् यत्किञ्चिल्लाघवकरं देहे तल्लङ्घनं स्मृतं बृहत्त्वं यच्छरीरस्य जनयेतच्च ब्रह्मणं रौक्ष्यं करत्वं वैशद्यं यत्कुर्यात् तद्विरूक्षणम् स्नेहनं स्नेहविष्यन्तं माधवक्लेदकारकम् स्तम्भगौरवशीतघ्नं स्वेदनं स्वेदकारकम् स्तम्भनं स्तम्भयति यद्गतिमन्दं चलं ध्रुवम् चतुष्प्रकारः संशुद्धि पिपासा मारुतातपौ पाचनान्युपवासश्च व्यायामश्चेति लङ्घनम् प्रभूतश्लेष्म पित्ताश्च मला संसृष्टमारुताः बृहत् शरीरा बलिनो लङ्घनीया विशुद्धिभिः केषां मध्यबलारोगा कफपित्तसमुद्दिताः वम्यकेसारहृद्रोग विसुच्यनससत्वराः पिबन्धगौरवोद्गार उल्लासारोत्सकादयः पाचनैस्तान् विषप्राज्ञा प्रायेणादा उपासरेत् येन एव यतोदिष्ट येषामल्पबलागताः पिपासा निग्रहस्तेषाम् उपवासैश्च ताञ्जयेत् लोकाञ्जलेन् मध्यबलान् व्यायामातपमारुतैः बलिनां किं पुनर्येषां रोगाणामवरं फलम् भवदोषिणां प्रवीणानां स्निग्धाभिष्यन्ति ब्रह्मिणां शिशिरेरङ्गनं शस्तम् अभिवादविकारिणां शोषाशोग्रहणी दोषै व्याधिविकर्षिताश्रये तेषां प्रज्ञानमांसानां ब्रह्मणा लघवोरसाः स्नानमुत्सादनं स्वप्नो मधुरा स्नेहवस्तयः शर्करा क्षीरसर्पिषि सर्वेषां विद्धि ब्रह्मणं कटुतिक्तकषायाणां सेवनं श्रीष्मसंयमः कलिपिण्याकतत्राणां मध्वादीनां च रूक्षणम् अभिष्यन्नामहादोष मर्मस्थव्यादयश्च ये उरुस्तम्भप्रभृतयो रूक्षणीयानि दर्शिताः द्रवं तन्वसरं यावत् शीतීकरणमौषधम् स्वादुतिक्तं कषायं च स्तम्भनं सर्वमेव तत् पित्तक्षाराभिदग्धाये वम्यनिसारपीडिताः विषस्वेदानि योगार्था स्तम्भनीयानि दर्शिताः दोषाणां बहुसंसर्गात् सङ्कीर्यन्ते उपक्रमाः षड्वं दुनाति वर्धन्ते त्रित्वं वातादयो यथा
Now I would like to invite Dr. Kiran Gouda sir for his special talk on the topic Langana Brahmani Adhyaya. Over to you, sir.
Namaste, sir. Namaste. Thank you, Srikanth, sir. Are the slides visible?
Yeah, yes, sir.
Thank you,
Slide
sir.
is visible, sir. Sir,
Firstly,
make it to the full screen, sir.
Firstly, I would like to offer my humble pranams at the lotus feet of Parama Pujya Jagat Guru Nirmalanand Swamiji and Sominath Swamiji. And I also invoke the blessings of my teacher, Dr. Ishwar Reddy, sir. And I take the opportunity to thank Dr. Lakshmi Narayan Shinoy for giving me this opportunity. Sir is the director, Government Research Center, Mysore. And I also take this opportunity to thank Mamta Madam, Principal, SDM Ayurveda College, Udupi, Niranjan sir, Dean, PG and PhD Studies, SDM Ayurveda College, Udupi, and Nagaraj sir, the Medical Superintendent, SDM Ayurveda College, Udupi. Then I also take this opportunity to thank Department of Ayush, Government of Karnataka, and Vishwa Ayurveda Parishad. Yeah. With this brief thing, I think if the organizers permit me, shall I start? Am I audible?
Sir, audible?
You're audible, Kiran Gouda sir.
Thank you,
You
sir.
can start.
The full screen ಮಾಡಿ sir slide.
Try ಮಾಡಿ ನೋಡ್ತೀವಿ ಸರ್ ಫುಲ್ ಸ್ಕ್ರೀನ್ ಮಾಡೋದಕ್ಕೆ.
Okay, sir.
ಬರ್ತಿದ್ಯಾ ಫುಲ್ ಸ್ಕ್ರೀನ್?
ಇಲ್ಲ ಸರ್. ಸರ್
ಕಿರಣ್ ಗೌಡ ಸರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ, ಪರವಾಗಿಲ್ಲ.
ಒಂದೆರಡು
ಗುರುಗಳೇ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬಿಡಿ. ಆಯ್ತಾಯ್ತು, ನೋ ಪ್ರಾಬ್ಲಮ್. ಅಲ್ಲ, ಸ್ಕ್ರೀನ್ ದೊಡ್ಡದಿದ್ರು ಪರವಾಗಿಲ್ಲ, ನೀವು ಸ್ಟಾರ್ಟ್ ಮಾಡಿ.
ಸರ್ ಆಯ್ತು
ಈಗ ಸರಿ ಆಗ್ತಿದೆ ಸರ್?
ಆಗಿದೆ ಸರ್, ಆಯ್ತು.
ಥ್ಯಾಂಕ್ ಯು.
ಓಕೆ ಸರ್, ಸರಿ ಸರ್.
Topic that is given to me by Dr. L.N. Shinoy is Langana Brahmani Adhyaya. Langana Brahmani Adhyaya probably is one among the Yojana Chatushka, which is the 6th Chatushka. And when we look at the presentation of Sutrasthana in Charaka Samhita through Chakrapani's views, he says this Chatushka, Swastha Chatushka, Nirdesha Chatushka, Kalpana Chatushka, Roga Chatushka, Yojana Chatushka, and Annapana Chatushka. Yojana Chatushka. And when we also look at the definition of Yukti Upashaya Chikitsa that is explained in Charaka Sutrasthana 11th chapter, 54th shloka, he says, Yukti Upashayam Punaha Ahara Aushadhi Dravyanam Yojana. So, if the Ahara Aushadhi Dravyanam Yojana is to be taken into consideration, Chatushka, in this Yojana, the Annapana Chatushka, Ahara Aushadhi Yojana, if we are looking at Yukti Upashaya Chikitsa. But the same when we look at Ashtanga Hridaya, he has explained and the presentation of Ashtanga Sutrasthana is concerned, the Sutrasthana, though it consists of 30 chapters, in the 30 chapters, the first 10 chapters, Hemadri explains this as Hetu Skanda. The 11th and 12th chapter as Lakshana Skanda. And then from 13th chapter to the last chapter, he explains it as Aushadhi Skanda. So the presentation is little different from what Charakas as well as Ashtanga Hriday's presentation. The 11th chapter, which starts with Lakshana Skanda, and then the 13th chapter, which starts with Doshopakramaniya. The next chapter itself is Dvidopakramaniya Adhyaya. The principles that are explained in Langana Brahmaniya Adhyaya are most of them taken into Dvidopakramaniya Adhyaya in Ashtanga Hridaya Chikitsa. And when we look at Shadvida Upakramas, the Shadvida Upakramas that are explained by Charaka, Langana, Brahmana, Kale, Rukshanam, Snehanam Tataha, Svedanam, Stambhanam Chaiva, Janiyate, Yasa, Bishat. These 6 Langana Brahmaniya chapter, that is Shadvida Upakramas that are explained in the chapter Langana Brahmaniya. Further, in Ashtanga Hridaya and Ashtanga Sangraha, they are concised into 2 called as Dvidopakramaniya, and that is Langhana or Brahmana and Santarpana or Apatarpana. That is, Langhana Chikitsas are to be implemented in Santarpana Rogas, and Brahmana Chikitsas are to be implemented in Apatarpana Rogas. When we look at this, and when we look at Charaka Samhita, in Langana Brahmaniya Adhyaya, though he has explained Langhana, Brahmana, Snehana, Rukshana, Svedana, Stambhana, still Snehana and Svedana are the chapter that which are explained in 13th and 14th chapter respectively in Sutrasthana. But this particular chapter is explained in 22nd chapter. And hence, though earlier, probably in 13th and 14th chapters, Snehana and Svedana is dealt extensively, I will not be dealing about that. And I will be dealing extensively on Langana as well as on Rukshana. Brahmana probably next scholar may speak extensively, and hence Brahmana and Stambhana I will not be speaking extensively, and I will be speaking only a short thing about Brahmana and Stambhana. Now the definitions, as far as the definitions are concerned, it is very clear. Yat kinchit laghavakaram dehe tad langanam, that which is any procedure, any medicine, any ahara, or anything that is able to give this effect called as lightness is what is grouped under Langana, and that which has the effect of increasing is called as Brahmana, and so on and so forth. These are the definitions. After the definitions, when we look at types of Langana, the types of Langana that are explained by Charakacharya are Chatuspakara Shamshuddhi, Pipasa, Maruta, Atapa, Pachana, Upavasa, Vyayama. These are the 10 types of Langanas. And this becomes the basis for Panchakarma. Why this becomes the basis for Panchakarma is, when we look at Chatusprakara Shamshuddhi that is explained by Charaka, he has included Vamana, Virechana, Asthapana and Nasya. When he has included these 4 and he has not included Anuvasana Basti here, there is a reason for that. We will be talking or deliberating about that later. Anyhow, Chatuspakara Shamshuddhi is a very basic thing that is responsible or that is required for us to understand the principles of Shodhana. And when it comes to Shodhana, we will have to, when you look at the next shloka, wherein he says, Prabhuta Shleshma Pitta Asramalaha, Samsushta Marutaha, Bruhat Sharira, Balina, these are the conditions where we can go ahead with Langana. For example, Prabhuta Shleshma Malaha, Prabhuta Pitta Malaha, Prabhuta Asramalaha, then Samsushta Marutaha, Bruhat Sharira and Balina. When we look at this, we will have to further probably categorize this into Swastha as well as Athura. In case we are going to categorize this as Swastha, then we need to understand in which Swasthas this particular Chikitsas are to be given. For example, once again, if you look at Ashtanga Hridaya, Roganutpadini Adhyaya, once again Hemadri Tika, Hemadri categorizes Swastha as Dvividohi Swasthaha, and in this Dvividohi Swasthaha, he categorizes Sanchita Rupa Swastha and Asanchita Rupa Swasthaha. Only in Asanchita Rupa Swastaha, probably Rutu Anusara Shodhana is required, and in Asanchita Rupa Swastaha, probably it is not required. And who are these Asanchita Rupa Swastaha? These Asanchita Rupa Swastaha are the ones who are following the others, such as the Dinacharyas, etc., that are properly following the other aspects of Dinacharya, etc., where there is no scope or there is no accumulation of the doshas. And when we look at the other Sanchita Rupa Swastaha, if we do not act at this stage, Sanchita Rupa Swastaha, at this stage, if we do not act, then probably the effect of this Gramya Ahara, that is explained in Charaka Chikisasthana, 1st chapter, 2nd pada, 3rd shloka. When we look at this, wherein he has explained about the effects of Gramya Ahara that can happen on a human body, wherein he says first there will be Shitilata of Mamsa. When once Shitilata of Mamsa is there, then there can be Vimunchete Sandayaha, that there is displacement of the sandhis. We usually nowadays get lots of cases of cervical spondylosis, lumbar spondylosis, or disc prolapse, or when you look at osteoarthritis, the joint space reduction. All this is Vimunchete Sandayaha. When once we have this Gramyahara leading to Chitilata in Mamsa, leading to Vimunchete Sandayaha, this further is going to trigger the inflammation. Then he says Vishendete Raktaha, then there will be other consequences. So these things that are happening inside the human body are because of Sanchita Rupa Swastaha, and this Sanchita Rupa Swastaha is once again, this is a condition where we are supposed to go ahead with Shodhana. Now, whenever this is Bruhat Sharira and Balino is there, Bruhat Sharira and Balina are the ones which are required for conducting Shodhana in Atura as well as in Swastha. Now, even in Ashtanga Sangraha Sutrasthana Roghanutpadana Adhyaya, 25th chapter, 25th shloka, if you look, he says, those who do not subject themselves for the Rutu Shodhana, or whenever there is Sanchita Rupa Doshas, and they are swastha, at this condition, if they are not subjecting them for themselves for Shodhana, then this, he has termed it as Beshajadveshi. And in this condition, this Beshajadveshi can give rise to a big set of diseases, and he has explained almost all the Santarpana Vikaras, that in case any Sanchita Dosha Swastha do not subject themselves for these types of Rutu Shodhana, then they are called or termed as Beshajadveshi. And Beshajadveshi's set of diseases, he has explained many of the Santarpana Rogas, including certain set of gastrointestinal tract diseases such as Grahani, etc., or Pranamahasoto diseases such as Kasa, Shwasa, etc., or cardiovascular diseases such as Upalepa, etc. Then he has also explained Staulya, metabolic diseases, many of these non-communicable diseases. He has explained under this, that is, whenever any swastha is once again divided into two, Sanchita Rupa, Asanchita Rupa. Asanchita Rupa are the ones who follow the Dinacharyas properly and the Ahara Sevana Niyamas and the Ahara as per the Rutu. And in them, there is no Sanchaya of doshas. So in those category of persons, there is no need of Shodhana, Rutu Shodhana. Whereas the others who do not follow this, then in them there is Sanchaya of doshas. These Sanchita Rupa patients or categories are the ones who are labeled as Beshajadveshi. And these Beshajadveshi are the persons whom, if Shodhanas as per the seasons are not conducted, then they are susceptible for certain group of Santarpana Rogas. And these Santarpana Rogas are explained under Roghanutpadani Adhyaya, probably 25th shloka in Ashtanga Sangraha. And these, that is where Prabhuta Shleshma Pitta Asramalaha is for disease condition. Samsushta Maruta is once again for disease conditions. Bruhat Sharira Balina are also, they are also for disease conditions as well as for swasthas. Swasthas, I mean only Sanchita Rupa Swastha. And now whenever it is Prabhuta Shleshma Malaha, probably we will have to go ahead with selecting the procedures such as Vamana. Prabhuta Pittamalaha, we are supposed to select procedures such as Virechana or Raktamokshana. Asramalaha, once again Virechana and Raktamokshana. Samsushta Marutaha, depending upon what type of diseases There are, we will have to, that is what he says, among these 6 Shadupakramas, we are now going to choose a combination of either Langana Svedana or a combination of Langana, Svedana and Rukshana, or so on and so forth. Choosing the combination of certain treatment procedures and certain medicines that are required for that particular stage is what is Shadvida Upakrama or Yojana Chatushka, or the whole gist of this particular chapter called as Langana Brahmaniya Adhyaya. Next, I have taken one sloka that is from Ashtanga Sangraha once again, Dvivida Upakramaniya Adhyaya, wherein he has said, Tatra Samshodhanehi, though Charaka has explained this, that is Prabhuta Shleshma Pitta Asramalaha, Ashtanga Sangrahakara has included Staulya. And if you look at the next sloka, Madhya Staulya, and then he has included Hina Staulya. That means he has given us a clue that there is a need, or we are supposed to categorize diseases based on the Bala as Hina, Madhya and Staulya. In case of Staulyas, if not Staulyas, any other disease, Pakshagata or Meha or any other disease, there is a need for us to categorize them as Hina, Madhya and Staulya. That means Staulya is where there is Baladikya. Madhya Staulya is where the disease is not that Balawan and it is moderate. Hina Staulya is the disease where there is only a little thing. For example, if I can take something called as overweight or obese, grossly obese. If we are going to differentiate like that, based on whatever parameters, assessment parameters that we all want, we can take that and then we can categorize them under Alpa, Madhya and Pravara. Right, when we do this, then there is a need of categorizing such diseases, all the diseases where we are posting them for Samshodhana, Tatta Samshodhanehi. Though Charaka has said Prabhuta Shleshma Pitta Asramalaha, in all those diseases, wherever there is Prabhuta doshas or wherever there is Pravara involvement of the doshas, in all of them, in all of those diseases where in Vamana or in Virechana, Araha and Anarha, based upon that, we are now going to choose them. That is where Tatra Samshodhanehi Staulya, Bala Pitta Adikan, then Amadosha, Jvara, Chardi, Atisara. If you look at this group of diseases, they are self-limiting diseases. That is why he says they are all called as Madhya Staulya Adikan. Wherever, if you look at our approach, whenever a patient of Jvara comes, we do not usually choose Shodhana as the first line of treatment. Our first line of treatment will always be Pachanadipana, or our first line of treatment will always be Shamana. In case of Chardi, in case of Atisara, in case of Udayamaya, Vibhanda, Gaurava, these are the set of diseases which are usually self-limiting, or they do not usually cross into a severe vitiation. They are usually moderately vitiated and they are going to cause some sort of discomfort to the patient, such that the patient approaches a doctor and the doctor usually treats them. And this is where we usually go ahead with Pachana Dipana methods, and these Pachana Dipana methods are summed up as something called as Shamana. And whenever it is Hina Staulya, there is no need of Shamana, or there is no need of Shodhana. Then probably changes in lifestyle, such as if a patient of diabetes comes to us, if the patient of Madhumeha comes to us saying that he has just a very marginal rise in sugar levels, then in all of this, what do the doctors usually suggest? They usually ask him to eat less, work more. Eat less, work more. This is a very small change. That is what is wherein we are going to include them as Sutrasthana, Nigraha, etc. So these small changes in the lifestyle, that any suggestions that are being given by the doctor as to walk or to go for a physiotherapy, etc., any of these small changes which are going to increase the physical exercise, and any types of diet suggestions which are going to decrease the input. Maybe if you look at the nutraceuticals, we usually categorize the ahara. We usually categorize the ahara into something called as major and minor. When we categorize into major and minor, major are the ones where we usually take the help of cereals, etc. And minor are the ones where usually we take the help of vegetables or say pulses, etc. And when once this is taken into care, then there is something called as essential and non-essential. Non-essentials are the ones where we take the help of fibers, etc. Though they are not essential for the human body to synthesize something or to liberate energy, it is required to flush out the waste. So non-essential and essential. So looking at this, we are usually going to advise the patient some changes in the diet or some changes in the physical activity. When once we do this, we are now going to look at Esha Madhyabala Rogaha, right? Esha Madhyabala Rogaha, Kapha Pitta Sabhatyutaha. If I am to take the example of Jwara, the first line of treatment that is indicated is Langhana. Now, if Langhana is indicated in Jwara, why the Acharyas have indicated Langhana is, if we look at the shloka that is explained in Grahani, Aharam Agnim Pachati. Usually the Agni does the Pachana of Ahara, whatever is given to the human body. In case the Ahara is not given, Doshan Ahara Varjitaha. If the Ahara is not given to human body, then the Dosha Pachana will start. When once dosha is not available, then also if Langhana is continued, then Dhatu Pachana will happen. When once Dhatu Pachana, even then if the person does not stop Langhana, then there will be Prana. Anyhow, now coming back to Aharam Pachati Shiki, Doshan Aharam Vivarjitaha. In case Ahara is not given, the Agni is going to digest the doshas. What doshas is the Agni going to digest? They say it is Kapha Pitte Drave Dhatu Sahate Langana Mahat. The Kapha and Pitta are the doshas which are Drava in nature. That means, if you look at the gunas of Pitta, Sasneham, Tishnoshnam, Lagu Visram, Saram Dravam. And this Drava Guna of Pitta, whenever Drava Guna of Pitta is responsible for causing Jwara or is taking a part in the Samprapti. For example, if you look at Charaka Nidhana Sthana, Pittaja Jwara Samprapti, he says Dravatvam Agnim Upahatya. That is, it is the Drava Guna of Pitta which is responsible for vitiation of Agni. Dravatvam Agnim Upahatya, he says. That is why, and in these conditions, whenever there is excess of Drava Guna, and when you avoid, when this particular patient is having Pitta Jwara, and he says the Jwara, which is Pitta Jwara, is Prakruta Jwara, in case it is in Sharad Rutu. He says Prakrutaha Sukhasadhyastu Vasant Sharadudbhavaha. In case Vasant Rutu, Kapha Jwara is there, Pitta Jwara is there in Sharad Rutu. These are the Jwaras where Drava Guna of Kapha is responsible for Agni Upahatya, and Drava Guna of Pitta is responsible for Agni Upahatya and giving rise to Jwara, that is Prakruta Jwaras. So in this Prakruta Jwaras, when Langhana is given, then the Agni is now going to do the Pachana of Drava Guna of Pitta, and hence whenever Drava Guna of Pitta is not present, then naturally there is no causative factor for Agni Upahatya. That is why Drava Abhava is what is very important for us. And then when we look at Jatragni Sandukshana and digestive Ahara, he says Pachanti Agnihi Pratipaksha Kshapanena. When Pratipaksha Kshapanena, here, whenever the Drava Guna of Pitta is the Pratipaksha that is responsible for Kshapana of Agni. When Pratipaksha Kshapana is happening because of Langhana, then it is very simple that this becomes a part of Pachana. And you see, even in Kapha Jwara, whenever Drava Guna of Kapha is responsible for Agni Upahatya and becoming a causative factor for Jwara, then this Langhana is enough here, and hence Langhana becomes a very integral part. So there are certain conditions where we are supposed to. For example, when you look at Meha, and when you look at Ashtanga Hridaya Meha chapter, he says this Vamana and Virechana are indicated only for Kleda Samshamanaya. Only for Kleda Samshamanaya. This is not for any other purpose here. The Meha, whatever Snehapana or whatever Meha, the Vamana or Virechana Dravya that we are selecting, it is aimed at only Kleda Prashamanaya or Kleda Shamshamanaya, and it is not with any other view. So in each and every context, when we look at Prabhuta Shleshma Pitta Asramalaha, when you look at Meha, Prabhuta Shleshma, he says Prabhuta Shleshma Malaha. When you look at Meha Samprapti, he says Bahudrava Shleshma Dosha Vishesha. When he says Bahudrava Shleshma is the Dosha Vishesha, Bahu Prabhuta Shleshma Malaha. So this is a condition where in case if it is Kafaja Prameha, and in this condition, if there is Bahudrava Shleshma that is involved, then Shodhana is the choice there, and the patient should be given Shodhana there. And if this is Yojana, if we are trying to do this Yojana, we cannot directly go ahead with Vamana in such conditions, because there is a clause for us saying that in Charaka Vimanasthana 6th chapter, if you all see, he says any person who is a Kafaja Prakriti person, if he comes across with any type of Kafaja Nidhanas, then he is usually prone for Kafaja Vyadhis. And when you look at Charaka Chikisasthana 15th chapter, he says, Dushatagnihi sadushtonnam natat pachati lagopi apachamanam shuktatam yatyanam visharupatam. And this visharupata, ama, is classified into two, Bahu and Alpa. Whenever it is Bahu, it is going to give rise to Anna Visha or food poisoning or Ajirna Lakshanas. Whenever it is Alpa, it is going to wait for others, such as Samsushtamanam Pittena Daha Trushna Mukamayan Janeti Amla Pittam Pittajamscha Aparangadam. That is, this Ama now combines itself with Pitta, can give rise to Daha or Trushna or Mukamaya or Amla Pitta or so on and so forth. Similarly, if the Ama combines itself with Kapha, giving rise to Sama Kapha, it can give rise to diseases such as Ekshma, Pinasa, Meha, etc. So, whenever there is this Bahudrava Shleshma, that which is triggered in Kafaja Prakriti, because he has exposed himself for Kafaja Nidanas, these Kafaja Nidanas are something that which has explained as Nidanas in Meha, such as Asya Sukam, Swapna Sukam, Dadini, Gramya, Audaka, Anuparasaha Payamsi, Navannapanam, Guda Vaikrutam. So any Kafaja, Kafala Prakriti, Kafa Samsishta Prakriti persons exposing himself for Kafaja Nidanas or Meha Nidanas, in them there is Bahudrava Shleshma, and this Bahudrava Shleshma is responsible for initiating or it's taking the part. So in this Bahudrava Shleshma, if we are supposed to go ahead with Shodhana as mentioned in Charaka, we are supposed to even take into consideration other aspects, because it says it is a Yojana. So Yojana is combination of treatment. We cannot go ahead directly with Shodhana or Vamana. We are supposed to combine itself with Rukshana, because in Rukshana, if you look at this particular sloka, Rukshana, the indications for Rukshana are Abhishanna Srotas, Mahadosha, Marmasta Vyadayascha. See, if Abhishanna Srotas is where there is oozing. Mahadosha is involvement of excess amount of doshas or the combination of the three doshas. Marmasta Vyadayas is, in case of Meha, there is a Trimarma. In this Trimarma, Basti is one Marma. If you look at the Samprapti, he says, Medasya Mamsasya Sharirajam Cha Kledam Kafopastikata Pradusham. So, whenever the Kleda that is present in the Meda, in the Mamsa, in the Sharira is drawn towards the Basti, and then it is going to cause. So, there is Mahadosha, there is Abhishanna Srotas, and there is Marmasta Vyadaya. Urustamba Prabhutyaha. In this Urustamba Prabhutyaha, when you look at the Chakrapani Tika, he says Meha is also one among those. So in these diseases, Rukshana along with Langana is to be considered as a combination of treatment, such as in case of Meha, if at all we are trying to post any patient for Vamana or Virechana, if the patient is obese NIDDM or Stula Madhmeha as explained by Sushruta, wherein he says Stula Madhmeha is usually because of Apatharpana. Apatharpana is not having any hereditary contributions. In this apatarpana stula madhumeha, he says it must be bakwashi. The patient will be a voracious eater or he'll be eating again and again. Bakwashi, snigdha, Shayya asana swapna shilaha. When these features are there, we are going to identify this as stula madhumeha. That means even if it is a moderately built person who is not overweight, who is not having excess of BMI, if this moderately built person comes with bakwashi, snigdha, shayyasana swapna shila, we are going to categorize him under stula madhumeha, and in this stula madhumeha, we are going to post the patient for first rukshana therapy. Rukshana therapy can be abhyantara or bahya. Abhyantara can include something like takra or kashaya panas, etc. Bahya, specifically in these conditions where madhumeha is there, where Svedavaha Srotas is also involved. These days what is happening is, we see many of the people using AC cars, AC climate in their offices, AC in their houses, etc., where the constriction of Svedavaha Srotas takes place, and this Svedastu Kleda Vidruti or Mutram to Kleda Vahanam. Whenever the Sveda is unable to expel the mala out, the load is on the kleda increases, and this kleda is now thrown out through mutra. So what is happening is, there will be something called as increase in the urination. So in all such conditions, we are supposed to use Bahir Parmajan Chikitsa such as Udvartana. If you open up Udvartana in Sushruta Chikitsa Sthana 24th chapter, Anagata Abhada Pratishediya Madhyayam, he explains Udvartana as Tvachastha Agnehe Tejanam Siramukha Viviktatvam. This Udvartana that we are going to use is going to do the Tvachastha Agnehe Tejanam, because Brajaka Pitta is very, very important for the pachana of any Kriya Dravya such as Abhyanga, Alepa, etc. If Brajaka Pitta Manda is there because of the effect of this meha, then in all such conditions, Udvartana, when once Udvartana is done, Siramukha Viviktatva takes place. When once Siramukha Viviktatva takes place, the sweat is properly conducted, the load of Kleda Dushti comes down, and remember, Kleda is now being thrown out through the Motra because Svedavaha Srotas is constricted, and when once Udvartana is done, the load is now decreased. So Udvartana is to be done, and even for otherwise, he says, if you are going to go ahead with Snehapana, he says Mamsala, Medhura, Bhurishleshma, Vishamagnescha Purvam Rukshet. In all those patients who are Mamsala, who are Medhura, who are having Bhurishleshma, Vishamagni, in all these patients, we are supposed to go ahead with Rukshana Karma to avoid Sneha Vyapat. So whenever we are going to come across with a patient called as Meha or Staulya or certain set of patients, in those set of patients, we cannot directly go ahead with Vamana or Virechana. We are supposed to combine the treatment that are explained in Shadvido. The first option will be Rukshana. Rukshana can be done till Samyak Langhana Lakshanas are observed. When one Samyak Langhana Lakshanas are observed, then depending upon the need, if there is a condition called as Vataja Meha, then we are supposed to go ahead with only Sadhyo Sneha. If that is the Kafaja Meha has turned into Pittaja Meha into Vataja Meha, here in this particular conditions, we cannot directly go ahead with Arodha Krama Snehapana. If the patient is having only Avanya Janya Madhumeha, in this condition after Rukshana, we can definitely go ahead with Arona Janya Snehapana. Whereas if the patient is showing symptoms of Madhumeha, we cannot go ahead with Arona Jana Snehapana. We are supposed to go ahead with only Sadhyo Sneha, because he has said Vishabhigata Pedakanam Meha Pandu Kamalancha Nati Tiddan Vishodet. So in all such conditions where there is Vata Bahulata and there is Madhumeha, in all such conditions, Gambhira Dhatus are being thrown out, Mahatyato Avastha is obtained. In all such conditions, Arohana Snehapana cannot be given. We can only give Sadhyo Snehapana. In other cases, wherever there is Avandajanya Madhumeha, the Avandajanya Madhumeha or the other Madhumehas, he says we can identify that Ashtanga Hridayakara has given us a clue stating that Kshanat Kshinaha, Kshanat Purnaha. The blood sugar levels or the symptoms of the patients will vary. Kshanat Kshinaha, Kshanat Purnaha Bhajate. So this Avana Jana Madhumeha, whenever a patient comes to us with variations in blood sugar levels, variations in symptoms, in all these patients, this is Avana Jana Madhumeha, and in this Avana Jana Madhumeha, we can directly go ahead with Rukshana followed by Arona Jana Snehapana, then whatever the prakriti of the patient is. Because in Sutrasthana, if you see, he says Tatraditayava Snigdhamanyatamena Triyangvadadi Siddhena Tailena Vagrutena Vamayate Pragadam Tadanantram Virechana. Right? When once Vamana is done, then you can go ahead with Virechana. So if we are going to take one particular conditions, we are supposed to take 2 or 3 such help of the treatments. And when you look at Meha itself, after you are putting the patient for Vamana, you cannot go ahead with normal Peyadi Samsarjana in case of Vata Samsrushta, or where there is Meha, where you have opted for Sajjosneha. You are supposed to go ahead with Brahmana, or else it is going to give rise to certain complications. Or he says it is Tarpana Dikrama, that which is useful. Charaka Chikisasthana 6 chapter once again. And once, if it is the other way around, if it is Avana Jana Madhumeha, you can go ahead with Arona Jana Snehapana, followed by first Rukshana, Arona Jana Snehapana, Vamana or Virechana, then you can go ahead with Peyadi Samsarjana. After Peyadi Samsarjana, once again, it is Praghada Udvartana, Vyayama is very, very important. Praghada Udvartana and Vyayama is very, very important. And in all those patients where the father and mother are both having diabetes and they are now scared because their children may also get diabetes, because there is lots of matter that is available in the internet these days. Though the prakriti of the patient, the children and the parents are different, still because of the matter that is available in the internet, they are scared. In all those patients who are scared that the children may get Meha, they may get Staulya, etc., we have something called as in Sushruta Chikisasthana 12th chapter, he has given us one false formula called as Navayasa Churna, Jataryam na bhavati, Meham na bhavati. Right? If we are going to judiciously administer Navayasa Churna, Jataryam is Taulyam na bhavati. Jataryam explained by Shusuta and commented by Dalana as Staulya. Staulyam na bhavati, Meham na bhavati. So, if we are going to use any of these Shadvidopakaramas, especially the Langana ones, the Langana, Chatusprakara Samshuddhi, as I said, if we are going to use Prabhuta, Shleshpamalaha, I took the example of Vamana, in Meha, Prabhuta, Pittamalaha, Prabhuta, Asramalaha, and Bruhat Sharira Balinova. Bruhat Sharira Balinova, I have taken the example of Swastha. And Swastha is 2 types of Swasthas, Sanchita Rupa, Asanchita Rupa. Only in Sanchita Rupa we can go ahead with Rutu Anusara Shodhana. And when it came to Alpa, Upavasirupi Langana, I took the example of Jwara, the Prakruta Jwara, especially whenever it is Vasanta Rutu, Kapha Jwara, or Sharad Rutu, Pitta Jwara, especially when there is the Drava Guna vitiating the Agni Upahatya. And in such cases, whenever we do not give ahara and this Agni is going to act upon the Dravaguna, when Dravaguna excess is not there, then it cannot take part in the Samprapti, so Jwara is not there. So this is one. That is how either the combination of Vyayama, combination of diet, combination of Rukshana, combination of Langhana, and the Shodhanas are to be chosen judiciously depending upon the need in any particular person. Yeah. Now, one small thing about Maruta. Exposing to Maruta Yadyapi, he has said very clearly, though Maruta, how does Maruta act as Langana, it is because of the Swarupa that it acts as Langana. That is why in some patients we see that we are supposed to ask the patient to go and expose himself for wind. Right? And then there is Atapa Rupa Langana, and this in Atapa Rupa Langana also, if you see these days, lots of patients, there is vitamin D3 deficiencies. Vitamin D3 deficiencies, usually what happens is Indians, when we take the international standards, Indians have little less than the international standards. That is probably the Desha effect. So we will have to look at whether the patient is having any symptoms or no. Just because there is a big trend called as checkup, all these patients go for annual checkup, and in this annual checkup they come across vitamin D3, less vitamin D3, and they are now anxious, and they go and visit the doctor showing the reports, and the doctor identifies D3 deficiencies, and then they put him on vitamin D3. Whenever such things happen, there is a very serious disease or a complication that can happen called as hypervitaminosis. Hypervitaminosis is very common in D3, and this is more dangerous than cancer. Right? And hence, we need to know exactly that in Desha such as India, vitamin D3, until and unless there is something called as symptoms suggesting vitamin D3 deficiencies, if there is only reports, then we need not worry, because in Sutrasthana 15th chapter is very clearly said, Vailakshanya sharirasya asthaya tatatevacha dosha dhatu malanam parimanam na vidyate. That is, Vailakshanyat, Dalanacharya says Vailakshanyat is Vishadrushatvat. And Asthayatva is, it is about the diurnal changes. Whenever he says Vishadrushatvat, he says Dirgha Hriswadi Kaya Bedena, Rasaraktadi Sara Bedena, Vata Pittadi Prakruti Bedena. There are so many variations, and in these variations we cannot definitely quantify any of the physiological parameters. That is why we usually have a range called as a fasting blood sugar in between 80 and 120. There is a range. There is nobody who is going to have exactly 100 mg. So there is a big range. So this range, once again, fasting blood sugar, postprandial blood sugar. If you see fasting or postprandial, all of this is once again based mainly upon kapha. Immediately after food, kapha rises. And in Divasarambe, kapha rises. So we are supposed to very clearly observe and then say, and hence, whenever it is vitamin D3 deficiencies, only simple Atapa Sevana is enough. If the patient is not having any symptoms, there is only a laboratory investigation suggesting there is vitamin D3 deficiency, there is no need to worry. If there are mild symptoms, if the patient exposes himself for sunlight, that is enough. There are so many such diseases where we can definitely use our yukti to justify saying that this is what is required. Now, after a brief note on Langana, let me try to go ahead with very fastly, because Shinai sir has given me only 1 hour time. I think it is already 4 now. Anyhow, as far as Brahmana is concerned, Brahmana, in the next chapter, Charaka explains about 2 types of Brahmanas, mainly such as Sadhya Tarpanaha, Kalantara Tarpanaha, or Ruksha Tarpanaha and Snigdha Tarpanaha.
Kiran sir, you can continue, no problem. Up to 5 o'clock you can continue, no problem.
Thank you so much, sir.
It was really wonderful.
Thank you so much, sir. Because I am the teacher. Teachers usually do not stop. One thing. Second thing is I am the principal. There is nobody to stop me. I go on. Thank you. And as far as Brahmana is concerned, in the next chapter, Charaka explains about 2 types of santarpanas, and in these 2 types of santarpanas is very particular about Ruksha Tantarpana and Snigdha Tarpana, or Sadhya Tarpana and Kalanta Tarpana. Now, whenever it is a patient where we are going to give Brahmana, we will have to exactly know where we need this Ruksha Tarpana, and where we need this Snigdha Tarpana. And when we look at this Ruksha Tarpana, he says it is Amla Lavana Yukta. When we look at Charaka's 23rd chapter, Charaka, he says exactly like if you look at in the normal saline that is given, these days, the normal saline that is given, if you look at Charaka Samhita, Sutrasthana 23rd chapter, he says, Swadur Amla Jalakrutaha. Swadur Amla Jalakrutaha is something very similar to DNS, dextrose normal saline. This dextrose normal saline is a concept that is probably evolved of Swadur Amla Jalakrutaha. Whenever there is dehydration in a patient, either because of Atisara or because of Chardi or because of Jora, anywhere there is dehydration, to supplement that, rehydrate. We are going to rehydrate the patient, and this rehydration is usually done with dextrose normal saline. Swadur Amla Jalakrutaha is the concept, and this concept is called as Ruksha Tarpanaha, and this concept is called as Sadhyo Tarpanaha in Ayurveda. And in this, we were trying to use lots of mantras, etc. If you see, whenever you go to rural India, rural parts of India, and you visit any village or any of your grandparents, etc., they usually offer you a glass of lemon juice. And this lemon juice is the very concept of Swadur Amla Jalakrutaha. Because you have come out from outside, there is a tendency of dehydration. That is why to rehydrate you, they usually give lemon juice. And this lemon juice is prepared with Swadu, and there is sugar and there is water. Swadu, that which is very, very important for us. And when we look, he says there are conditions, and in all these conditions are the conditions where there is a tendency for dehydration. So all these conditions where there is a tendency for dehydration, in all these conditions, there are different types of mantras, there are different types of Swadur Amla Jalakruta preparations that are advised for us to supplement the patients or to rehydrate the patients. This is the one aspect of the Brahmana concept. In this Brahmana context, we are supposed to see whether the patient is having any signs of dehydration. The patient can be suffering from Jora, the patient can be suffering from Atisara, the patient can be suffering from Kasa, the patient can be suffering from Chardi, or any which have a tendency to give rise to dehydration. In all such conditions, there is something called as Sadhya Tarpanaha, and there are yogas explained in the next chapter which are Sadhya Tarpanaha. And these Sadhya Tarpanaha yogas are very similar to what these days the doctors are using, called as normal saline or ringer lactate or dextrose. These are very similar to the concept that I explained here. And whenever you see, if at all there is a patient who is having around 5 to 6 loose motions, the doctors usually don't put them on any pins. They usually give them ORS. Only when it crosses 10, they probably put him on 1 pint or 2 pints or 3 pints, depending upon how many times the patient had the loose motions. Similar concept is explained as Samsarjana Krama in Vamana or in Virechana. That is, for Avara Vegas in Virechana, 10 Vegas, there is 1 Annakala of Peyadi. And Madhyama Shuddhi, 20 Vegas, then there is 2 Annakalas. Pravara Shuddhi, 30 Vegas, then there is 3 Annakalas. That is, more of liquid is to be given. That is, there is dehydration, hence we are supposed to supplement. Then we are supposed to supplement. That is 1 pint, 2 pints or 3 pints. It can be 1 DNS, 1 normal saline, 1 ringer lactate. Depending upon that, the Peya, the Samsarjana Krama is designed called as 1 Annakala Peya, 1 Annakala Vilapi, or so on and so forth. So when we look at the concept of Brahmana, Brahmana is first of all to be understood as 2, called as Sadhya Tarpanaha, Kalantara Tarpanaha. Sadhya Tarpanaha is where Whenever there is a patient who is in a condition called as dehydration, in such dehydrated conditions, we are supposed to give Swadur Amla Jalakruta preparations, and this Swadur Amla Jalakruta preparations can be any of the preparations or any of the yogas that are explained. They can be given in all such conditions such as Jwara or Chardi or Atisara if there is dehydration. That is one part. The second part is where you are going to choose Snigdha Tarpanaha, where you are going to give Kalantara Tarpanaha. Snigdha Tarpana or Kalantara Tarpana is to be given in these conditions called as Kshina, that is Shatakshina, Krusha, Vruddha, Durbala, Nityadva, Stri Madhya Nitya, Grishma, etc. These are the ones where Brahmana is to be given, or in certain other diseases such as Shosha, Arsha, Grahani Dosha. In these conditions, wherever the person is gradually losing weight, in all such diseases, there is a need for choosing Kalantara Tarpana or Snigdha Tarpanas, and these Snigdha Tarpanas or Kalantara Tarpanas are in many forms. In many forms, you must have seen Agastya-Haritaki Rasayana, you must have seen Ashwagandha Rasayana. All of these are Snigdha Rasayanas. All of these can be given judiciously depending upon the need. We cannot directly go ahead with what is called as Brahmana. In certain conditions, probably we need to go for Alpa Langana, and then we can go ahead with Brahmana, because in case there is something called as Sroto Shuddhi required, then probably some sort of Langanas are to be done. When once Srota Shuddhi is also achieved, then we can go ahead with Brahmana. And there are others wherein simple measures such as Snana, Utsadana, Swapna, or Madhura Sneha Bastis, or Sharkara, Kshira, Sarpi. This Sharkara, Kshira and Sarpi are the ones where though the patient is having some sort of diseases, in these diseases, the patient is unable to take Brahmana material in the form of Aushadha, then probably we need to choose Sarpi and Kshira. That which is explained in Charaka Sutrasthana 16th chapter, wherein he says after Vamana and Virechana, this Beshaj Kshapita, the Beshaj Kshapita conditions are in all those conditions where because of Beshaja, the patient has become weak. That is taking antibiotics for a longer duration, taking steroids for a longer duration, or something like that. In all these basic Shabita conditions, we cannot directly go ahead with once again choosing something called as Snigdha Brahmanas. We are supposed to go ahead with Ahara Rupi Brahmanas such as Sharkara, Kshira, Sarpi, etc. So as far as Brahmana is concerned, because the probably next speaker is going to talk about Brahmana, I will restrict myself here to Brahmana. And then let me go ahead with the Rukshana. Rukshana, as I said earlier also, Rukshana, we are supposed to choose Rukshana in a very judicial manner. He says, Abhishana Srotas, Mahadosha, Marmasta Vyadayascha, Urustamba Prabhutayadaya. For example, if you look at Bhava Prakashas, Chikisa Sutra for Amavata, he says Langanam, Svedanam, Tikta Deepanani Katunicha, Virechanam, Snehapanam, Baste Chamamarate, and Sveda, he says Ruksha Sveda Vidatavyaha. Right? Whenever we look at the principles, if you see in Amavata, the Samprapti of Amavata, he says Vayuna Prerito Amaha Shleshmastanam Pradavati, Tena Atyartha Vidagdo Aso Damanim Pratipadyate, Vata Pitta Kafair Buyo Dushito Su Annojarasaha Srotamse Abhishannatvam. Srotamse Abhishannatvam Nana Varna Tipichilaha Janeti Ashudorbalyam Hudesha Chagorom. Right? Vyadinam Ashrayo Yeshaha Vyadishram Sangnam Atidarunaha Yugapat Kupitavantaha Strika Sandip Praveshako. Marmasta Sandip Praveshako. If you see there, Vata Pitta Kafair Buyo Dushito Sonajarasaha is Mahadosha. Srotamse Abhishannatvam is Abhishana Srotas. Yugapat Kupitavantaha Strika Sandip Praveshako is Marmasti. So whenever these diseases such as Amavata, such as Meha, in all these diseases, you always see the Chikitsa Sutra, including Ruksha. So this is a disease where Ruksha Sveda is included. See, in this schedule the Upakramas, this is a disease, Amavata is a disease, Sveda is included because Stambhagorava Shitagnam Svedanam Svedakarakam. This Sveda has the effect of decreasing Shula Prabhava. So Rukshana and Svedana ought to be chosen here, and we usually choose Valuka Svedas, any other Ruksha Svedas here in these conditions. So Abhishanna Doshas, Abhishanna Srotas, Mahadosha, Marmasta Vyadescha, etc. Such as Urustamba, he said, Urustamba, Meha, or Ramavata, in all these conditions. In Meha, it is Rukshana followed by Vamana Virechana, and after Vamana Virechana, it can be Pragada Udvartana on a periodical basis, because this Udvartana periodical basis is definitely going to see that there is Tvachastagneya Depanam and Shiramukha Viviktatvam. Whenever that is there, the Kleda is conducted properly, and hence the disease severity or the microvascular complications that there is a tendency in Madhumeha does not happen. What does he say? He says, Rasayaninam cha dhaurbalyat na urdhumuttishthante. There is a tendency of Rasayaninam cha dhaurbalyat in Meha. So, Praghada Udvartana, when once a patient comes to us, he is in Avannajana Madhumeha, we have chosen Rukshana followed by Snehapana, then Vamana or Virechana. After that, once again, once in a week or once in 2 weeks, Udvartana used to be regularly done, and we should ask the patient to do Vyayama. So, the combination of these treatments is very, very important. And as far as Amavata is concerned, if you see, it also has a component called as Abhishanna Srotas. It also has the component called as Maha Dosha and Marmasta Vyadeha. In such diseases, the combinations that the Acharyas have used are Langanam, Svedanam, Tiktadipanani Kadicha. Svedanam, which Sveda? Ruksha Sveda. So, Lepa, which Lepa? Once again, Ruksha Lepa. See, Agni Lepa, etc. These are the Ruksha Lepas. And Svedanam, these are the Ruksha Svedanams. So, all of this, if we look at Langanam, Svedanam, Tikta Dipanani Katuricha, Virechanam, Snehapanam, Tikta Dipanani Katuricha. When you look at this Tikta Dipanani Katuricha, and when you look at Charaka Sutrasthana, second chapter, where he has explained about different types of Yushas, and you can see there that he has used Panchagola Yusha, particularly for these conditions. So, in these conditions, when you look at this, the combination of Sveda, the combination of Langana, the combination of Rukshana is very clearly evident, and we are supposed to do the Yojana of these Shadvidopokramas. Only when we have such an approach, probably we will excel in clinical practice. Yeah, and after Rukshana, coming back to Stambhana, if you look at Stambhana, before I go ahead with Stambhana here, I would like to draw your attention to what Chakrapane has to say. Yeah, this is from Chakrapane for Stambhana. He says, Etancha Atisara Shonita Sruti Visha Daha Vedana Adishu Bodhavyam. Right? It is not only for Kevalavata, it is for Atisara Shonita Visruti Visha Daha Vedana Adishu. Whenever there is Samsushta Maruta, whenever there is inflammatory conditions, there is Vedana, you see the contemporary medicines or the Western medicines, what do they use? They usually use NSAIDs, that is non-steroidal anti-inflammatory drugs. These are all the ones, if you look at the mode of action of these drugs, they are COX-1 inhibitors or COX-2 inhibitors. They are going to inhibit this property, and hence anything that which inhibits is what is called as Stambhana. Right? Vedana Adishu, he says, the Vedana, we are now trying to do this Stambhana of this Vedana. Stambhana of Vedana, how are we going to do? In case it is something like NSAIDs, these NSAIDs, how do they act? They usually act either through COX-1 inhibition or COX-2 inhibition. So COX-1 inhibition or COX-2 inhibition, there is inhibition. So inhibition is what is important for us. In Atisara, if you look at this, the Atisara or Shodhisa Visrava, etc. is very easy to understand. But as far as Vedana is concerned, we need to discuss, we need to deliberate. Probably Vedana Adishu, in which conditions of Vedana Stambhana Upakrama can be chosen, is what is to be discussed upon, deliberated upon. right? So in conditions wherever there is pitta vriddhi, for example, in case of whenever there is acid regurgitations or so on and so forth, we usually choose something called as Chara, something called as Charas. Right? For example, in case of Madhatyaya, in Charaka Samhita, Madhatyaya Adhyaya, he has very clearly said, Charohi yati madhuryam shigra amlopa samhitam. Charohi yati madhuryam shigra amlopa samhitam. Whenever there is a condition called as Amla Pitta, these days we usually see advertisements, or we usually see something called as acid peptic diseases. In all of these, they are usually going to give Eno or some of this Jalusil, etc. What they do, they usually do what is called as Charohiyati Madhuryam. Whenever there is an ash, if you give a base, it's going to neutralize that. Charohiyati Madhuryam Shikra Amlopasamitam. So Pitta, we are in these particular conditions, whenever there is an increase of pitta, we are going to use Stambhana. Kshara is one particular form of Stambhana where we are going to use, and this is Pachani Rupi Stambhana. If you look at Koshtagata Vata symptoms that are explained in Charaka and Koshtagata Vata Chikitsa, he says Ksharan Pibendaraha, and this Kshara is Deepaniya Pachaniya Kshara that is explained in Arsha, etc. So in such conditions, probably when we look at and when we judiciously are going to plan our treatment, we will be successful. With this, I would like to once again take this opportunity to thank Dr. Lakshmi Narayan Chinay, and who is the Director for Government Ayurveda Research Center, Mysore, and the Department of Ayush, Government of Karnataka, Vishwa Ayurveda Parishad, Karnataka, the Principal Dr. Mamta Madam, Dean Sir, and Nagaraj Bhujari Sir, the Medical Superintendent of HM College of Ayurveda, Udupi, and all my postgraduate students who helped me in this narration of this shlokas, and my colleagues who are all helpful in preparing these slides. Thank you one and all.
Thank you very much, sir, for your wonderful explanation of the chapter, Langana Brahmani Adhyaya. We will see in this, now this session is open for the discussion. The audience can ask the questions. The questions can also
Kiran Godaji, it is a really wonderful narration of the chapter, because we have given a new dimension for the whole chapter, and the practical applications were really mesmerizing. So we are really happy because we have conducted this Charaka Sambhasha to know, to learn, and to practice Ayurveda, and you did a really magical work here. Thank you, Kiran Godaji.
Thank you, sir. Thank you so much for giving me an opportunity.
If there are any questions, you can ask.
Srikant sir?
Yes, sir.
In case there are any questions from the delegates, even later, I have given my email in this presentation. They can just post the questions to my email, and I will definitely answer all those questions.
Okay.
Hello, sir. Sir, namaste.
Namaskara, madam.
Thank you very much for a wonderful presentation, sir. Sir, in a 72-year-old patient with Medovahasroto Dushti, that is, she has diabetes, also kidney disorder is there. So Medavaha Raktavaha is vitiated. Then how to choose Langana or Brahmana? How to decide a treatment line, sir?
Madam, when you said it is a Meha and she is suffering from kidney disease, may I know, is it diabetic nephropathy, madam?
Yes, sir. Complication of diabetes.
Diabetic nephropathy. What is her serum creatinine levels and what is her blood urea levels and how long she is suffering from this?
Sir, the patient is suffering from 2 years and serum creatinine is ranging from 3 to 4.
Okay. Blood urea, madam? Blood urea, madam?
Blood urea, I'm sorry, sir. I don't remember right now. But creatinine.
I will just grossly tell that. You can also please send me a mail about what are the electrolytes, the values of electrolytes, blood urea, as well as creatinine. Anyhow, in such patients, if the patient is the patient weak or she is moderately built?
She's weak, sir.
She is weak now.
Repeated fevers is there. Since 2 years, she's suffering this problem, and she has also undergone one procedure where stent is placed in kidney.
Stent is placed in kidney
For better filtration, because filtration.
Nephropathy then.
Sir.
This must not be diabetic nephropathy then. If you are talking about AV fistula, which they would have preferred for dialysis, stent in kidney is entirely different. There must be stricture or something else. If you can please send me the details, madam, to my mail, I will go through that and answer, madam.
Okay, sir. Okay.
Any other questions?
Questions, sir? Shall we wind up?
Okay. If there are any questions, as sir has told, you can mail the questions to sir's email ID. Shall I conclude, sir?
Yeah.
Okay.
In case Shinai sir permits.
Shinai sir?
We can conclude, no problem. It was a really wonderful session.
Thank you, sir. Thank you so much.
So we are very much thankful to the guest speaker for the wonderful deliberation of the chapter. On behalf of our institute, Department of Ayush, Government of Karnataka, Vishwa Ayurveda Parishad Karnataka, Government Ayurvedic Research Center, Mysuru, I wholeheartedly thank Dr. Kiran Goud sir, Principal, Sri Kalabhaireshwara Ayurveda Medical College and Research Center, Bengaluru, for the wonderful explanation. Thank you very much, sir.
Thank you, sir. Thank you. Thank you so much.
I also thank Dr. Mamta KV, the Principal, SDM College of Ayurveda, Udupi, for her support in such endeavors. I thank Dr. Lakshmi Narayan Shani, who is the backbone of this particular program, Charaka Sambhasha. Thank you very much, sir. I thank Dr. Nagaraj, the Medical Superintendent, SDM Ayurveda Hospital, and Dr. Niranjan Rao, the Dean for PG and PhD Studies, SDM College of Ayurveda, Udupi. I also thank the students, the PG scholars who have wonderfully narrated the Parayana or done the Parayana. Thank you, all of them. And thank our committee members, the team, the organizing team, Dr. Vijayendra Bhatt, Dr. Nishant Pai, Dr. Yogesh Acharya, Dr. Srinidhi Dhanya, Dr. Sandesh Kumar, Dr. Sadananda, and Dr. Arhant Kumar. And I thank you all the audiences for their wonderful presence and discussions. Thank you one and all. Thank you very much.
Thank you, sir. Thank you.